Hello, so in this video we're going to talk about how to answer select all to apply questions. A lot of people tell me that they really struggle with SATA questions, which is totally normal. But I will tell you the reason why you're struggling with SATA questions is, or one of them is because you're focusing more on the format of the question than you are on the understanding portion of the question. So, or the content associated with it. So it really is going to stem on how well you get the content, and then also your ability to pay really close attention to keywords. So you have to learn how to identify those keywords, and you need to realize that whenever you see a question, right, and you see the answers, if a part of the sentence is wrong, it's all of it is wrong. So I'll show you what I mean by that in a second. So and that's why you have to be confident what you know, because otherwise the statement could look, oh, I remember that, but if you don't really know it like really well, then you're going to easily pick the answer because it looks like it's right, not because you really, really know it. So looking at this question, which says, which of the following information should the nurse provide to the parents of a toddler diagnosed with cerebral palsy? Select all that apply. So we have A, regular developmental screening is important to avoid secondary developmental delays. B, cerebral palsy is caused by injury to the upper motor neurons and results in motor dysfunction as well as possible ocular or speech difficulties. C, developmental milestones may be slightly delayed but usually require no additional intervention. D, parent support groups are helpful for sharing strategies and managing healthcare issues. So if you want to, you can go ahead and stop this video for a minute, and then think of the answer and then start it again when we go over the answer, which is like right now. Okay, so let's look at the question. So first, what's the question telling us? It's asking us, which of the following information should the nurse provide to the parents of a toddler that has cerebral palsy? So, and it's a SATA question. So that means it could be more than one answer. And that means we need to understand what are the normal developmental expectations of cerebral palsy and how should the parent respond to that. So the first one says regular developmental screening is important to avoid secondary developmental delays. That's correct, right? That's definitely true. They have to get screening often. So that way we can, and regularly, so that way they can prevent more delays. B says cerebral palsy is caused by injury to the upper motor neurons and results in motor dysfunction as well as possible ocular and speech difficulties. That's also true, right? And everything about that is true. Like the whole statement, from the motor neurons to the motor dysfunction to the speech difficulties. Now, C says developmental milestones may be slightly delayed, but usually will require no additional intervention. So the first part of that is correct as far as the developmental milestones being slightly delayed, but it does require additional intervention. So C is not one of the correct choices. Hence, what I said earlier is that if you don't know the information very well, you may look at it C and be like, "Oh, that sounds right." But if you don't notice the whole sentence, if the whole sentence is not correct, then it's not correct, right? The whole statement has to be right. And then D says parent support groups are helpful for sharing strategies and managing healthcare issues. So that is also true as well, right? So having support groups that they can go to that will really help them during that time. So let me pull up the answer. See if I can pull up the answer. Okay, there we go. All right, so there's your answer: A, B, and D. All right, those are all. So delayed developmental milestones are characteristic of cerebral palsy. So regular screening and intervention is essential. Okay, so here's couple of things I want you to do if you did not get this answer correctly. Number one is you're going to want to spend more time looking at the whole statement and making sure the whole statement is correct. Okay? And then number two, look at the question and make sure you really understand what the question is saying so that way you can choose the correct answer. All right? If you need more help in this area, if you need more help, period, when it comes to preparing for your exam, then I want to encourage you to click the link either above or below this video and schedule a free NCLEX phone consultation so that way we can help you with your preparation for your exam. And then also as well, visit our website. Click the link below to access our RN or our LPN prep home study programs, because in there I go into way much more depth and I really help you to better understand the material and the questions and break it down correctly so you can pass your exam. Thank you so much for watching, and I'll see you the next time.